What are 3 myths about acupuncture today? I'm Dr. Daniel Hoover with Soma Integrative Medicine. So first off, acupuncture is part of a larger system of medicine, traditional Chinese medicine or traditional Eastern medicine. And acupuncture is one of the tools, one of the modalities where we use one-time use sterile needles. They're very thin. They're as thin as a hair, and they go into specific points of the body. There's hundreds of points in the body to help regulate the body, to help bring balance into the body. So there's several myths, but we're going to focus on 3. The first is it hurts, because after all, we're inserting sharp metal objects into your body. But it actually does not hurt, ironically. As I said, these are thin needles. They're as thin as a hair. So they're flicked in very quickly and you don't even really feel anything. I would say, in my experience, about 1 out of 10 needles, you might feel a slight prick. And then the pain is supposed to go away, which leads us to the second myth, that the acupuncture works every time, the first time. Well, it depends. What I'll say is, when acupuncture works, it works. And there's a reason why acupuncture is covered by most medical insurance, because they know that when it works, and it saves them a lot of money, especially with the opioid crisis we're dealing with today. Acupuncture is a great alternative to pain. But what about when it doesn't work? It's not a catch-all type of treatment. So when does it not work? That's the third myth, that it fixes or cures diseases. Maybe some, in certain cases, it can actually alter the chi flow where there was a stagnation and now everything is rebalanced. But most of the time, people are being referred to us, even by their medical providers that have the insurance that covers acupuncture, for low back pain or neck pain. Now, I've seen a lot of people for acupuncture for low back pain and neck pain, and you know what I found out? Sometimes it helps mitigate the pain. But why doesn't it fix the pain? What I want you to understand, what's important about seeking any licensed medical provider, is you have to have a clear diagnosis. You need to understand the root cause of the disease. And I would say 90% of the time, low back pain and neck pain is a mechanical issue. There's a vertebrae out of alignment. There's adhesions and scar tissue and muscles. There's a pinched nerve. There's a disc bulge or protrusion. So you're gonna need a mechanical correction. Most people go to surgery, but there's other ways to get, if you imagine, these are the vertebrae, and let's say this is the nerve coming out of the vertebrae and it's being pinched. I can do acupuncture all day around here and help with the inflammation, help with the flow. But if you've still got a rock on a hose or a bone on a nerve, you need to find a mechanical way to take that pressure off the nerve. So the myth is acupuncture is not always going to work, but when it does, it's going to. And if it doesn't, it's because you haven't found the generator of pain. And that's why at Soma we combine Eastern and Western medicine without the use of drugs or surgery, combining ancient wisdom, acupuncture, with modern technology. You want to learn more about how to combine these things and get to the root of your problem and heal as quickly as humanly possible? Hit the subscribe button, follow us on our social media, and we'll see you soon.